Hi, my name is Mary Robertson. I'm the Prevention and Screening Lead with the IU Simon Comprehensive Cancer Center. I sit in the Office of Outreach and Engagement, and our mission is to reduce Indiana's cancer burden by being the bidirectional link between our researchers and the community. And so here's just a quick structure of our office. I just wanted to show how we really embed both the community and research in each other, and how we have community advisory boards that really steer our work, as well as our different branch leaders and other staff that oversee our programming and operations. So I just wanted to quickly preview also our aims that we have, and how that really guides our work and our strategic planning for activities like we do for today's webinar. I'm going to touch on, again, a few of the aspects that I explained earlier in the title, but really touching on what is cancer looking like today in the U.S., specifically in the Midwest. What's that connection between nutrition, physical activity, alcohol, healthy weight, how that relates to cancer and rural health, and then also our telehealth opportunities that can help us reduce the cancer burden, as well as other chronic diseases. So looking at cancer across the U.S., it is a chronic disease, which many people may or may not be aware of. And so that really dictates how we approach preventing the disease, detecting it, and treating it, and really helps guide all of our guidelines from across the cancer continuum. So if you're looking at this map of the U.S., this is from the American Cancer Society. And a lot of the data today, especially on the prevention side, is pulled from some of their facts and figures. So as you can see, those are the new cancer cases distributed across the U.S. But as a whole, there's going to be about 2 million new cases diagnosed this year. And unfortunately, among those, there's going to be over 600,000 people that will die from the disease. So if you're thinking about the communities you live in, your work, your friends, if there's a really good possibility that you're going to be touched by cancer, whether it's you're yourself or diagnosed, or someone you know, your friends or family will. And so that's why we're really working to spread awareness, especially on the prevention and early detection side. I always also like to emphasize that everyone is at risk for cancer. Now, we do see that folks that are in older ages, that definitely increases your risk, also with some personal health information as that individual risk. But I like to say that cancer does not discriminate. Anyone at any time and age can get cancer. So it's really important that you know yourself, you advocate for yourself, and we're getting in for our routine care. Then specifically looking at our rural folks, unfortunately, rural residents often face higher cancer rates, both for incidence and mortality, and that is really multifactorial, which I'll dive into a little bit today. But some of that is due to our limited access for care specialists and those geographical barriers, including the distance to the clinics. All right, so looking on the prevention side. So on one part, it's really heavy that we do have a lot of cases in the United States. I also wanted to mention that really our greatest indicator for the cancer burden across the United States is looking at our cancer mortality data. Because we do have new innovations with screening, our detecting cancer cases, new ones can go in ebbs and flows. We're really looking at mortality and who is really suffering from the disease can give us a better snapshot. So we have seen that decline, which is great news. Really after the 90s, we really had a big spike due to tobacco use mainly before that. However, the great news is that a lot of cancers can be prevented. About 40% of cancers are linked to behavioral activities. And then within that, specifically looking at what is attributable to excess weight, alcohol, and diet and physical inactivity. That's going to be about 18% of our cases that are being diagnosed and about almost 15% of deaths. So the good news is we do have some control. There is a spotlight. Again, we do have a lot of things that are modifiable risk factors, meaning things that are in our control. However, all of those things are listed above: weight, alcohol, diet, inactivity, do contribute to our healthy weight status and our obesity levels in the United States. So the map that you're seeing below is based on data that we have up to 2023. And it's looking at the overweight status in the United States. So as you can see, those darker states, those are going to be areas where we have higher overweight percentages among our adults. And I do like to talk about overweight as well. I think obesity gets a lot of news, especially in the last recent years. We really talk about the harms of obesity. However, there are increased risks as well for cancer and other chronic disease for being overweight as well. So I like to point that out. So looking at 21 to 2023 data, 72% of adults were experiencing excess weight. And so that combines overweight and obesity. And then I also wanted to break it apart a little bit for our racial and ethnic groups. So you can see that it really affects all groups across the board. And so it's really important for everyone. We all need to really be a stakeholder in this. Then I know that this group tends to focus on the Midwest and some of the states a little bit more. So I did pull a little bit of data about that. Overall in the Midwest, about 34% of adults are considered overweight and about 37% obese. All right, so looking specifically at obesity and does it increase cancer risk? And the answer is yes. About 5% of cancers in men, and that is 11% of cancers in women. That is, we have really strong evidence that those can be attributed to increased cancer risk. So this chart I think is really great. It shows, it breaks it down by men and women, but it shows those risk factors that have the highest increased risk for cancer. And as you can see, you just go under cigarettes, UV radiation for men, excess body weight is right there. And then it's just flipped for women. It is the second leading risk factor for some of these behavioral components and infections. So that's really telling. That means we have a lot of opportunity for improvement, which is great news. So then, excuse me, looking at healthy weight and cancer risk, as I said, it is linked to 13 different cancers, so you can see those listed below. And I always say it's at least 13. Those are the cancers that we have really, really strong evidence for, but more and more data is coming out that it is likely several more cancers, and I really anticipate that we will be adding to this list in the coming years. What I do think is also interesting that you can see in this chart on the right is looking at those cancers as they're broken apart. So all of them do have increased risk from obesity, but it's not the same risk. So if you're looking at the top, our corpus uteri, that's our uterine cancers, you're going to have, that's a 53% increased risk. So that lighter blue, that lighter teal color, that's huge compared if you're looking down to the bottom, colon, rectum, or ovarian cancer, that's a 4 or 5% increased risk. So if you're looking at the total amount of colorectal cancers we see, only about 5% are attributable to being overweight or obese. However, that's still an increased risk. So I do like to share that. It's not all the same risk, but not good nonetheless. All right, so then looking at what does that really look like? I think some people are really interested in the data. Some people are really interested in those clinical pathways or those molecular pathways in the body. So I just wanted to touch a little bit on it for those that might be curious. And again, I have a lot more resources and research that I can share for those that are interested. But these are a few different ways that on a pathway level that obesity directly increases risk for cancer. So when we're looking at those fat tissues, that often increases amounts of the hormone estrogen. And we know we have several cancers that are fed by increased estrogen and then increase the risk. We also have blood levels that have increased insulin, and we know that increased like growth factor, those contribute to several increased risks for the cancers below there. Then we also have chronic inflammation. I know it's really popular. A lot of people are talking about anti-inflammation diets, and that's really popular in the news. Really separate conversation, but inflammation does promote tumor growth through several mechanisms in the body. The fat cells, besides estrogen, also produce other hormones. Those can also stimulate the cell growth of tumors or inhibit. So there is one hormone that does protect against tumor growth by having the cells not proliferate. However, we do not see these cells abundant in people that are obese, but we do see them more abundant in people that are at a healthy weight. So being at healthy weight is also considered somewhat of a protective factor. And then the last one is really just talking about how fat cells can also interrupt our regular metabolic functions and regulators, and those can protect against, those can then be damaged and impaired, which can lead to cancer. So has our understanding of obesity evolved? The answer is definitely yes, and we've made a lot of progress in the last few years. So as I stated previously, cancer is a chronic disease, so is obesity. And so in 2023, several leading organizations across the world came together to release a new consensus statement. And this really reshaped how we're thinking about obesity, how we're treating obesity. So really, they recognized there was lots of things to pull from the statement, but I think these are the most relevant. That it is a chronic disease and it does affect a lot of people. As you can see, 42% of adults and 19% of children in the US are considered obese. Um, and that obesity is characterized by the amount of fat. And so that is often measured by body mass index, BMI, which I think we're all very familiar with. What the statement does really well is it recognizes that this is a tool to screen for obesity, but it does not replace clinical judgment. So I think that's really, really important. There are other factors in an individual. It is not a measure of body fat alone. And so we really need to consider and work with our primary care providers and other provider care teams to really consider the whole person. And they also noted that every person with obesity does have the right to access evidence-based treatment. So does treating obesity reduce cancer risk? The great news is yes. So I've already talked about a lot about the increased risk, but let's talking about going backwards. If we are encouraging people to lose weight, to be active, to eat a really healthy, nutritious diet, are there benefits? And the great news is yes. So our studies are showing there's a few that show a couple different things. So the first point highlights a study among postmenopausal women who showed that even a 5% reduction in body mass was really beneficial for several cancers, especially endometrial cancer. There's also another study that looked at women over the age of 50 and their loss in body weight, and they had a decreased risk for breast cancer as well. So we do have several studies that show that it is beneficial to then work towards a healthy weight. Unfortunately, we don't have a ton of studies on this as we would like, because unfortunately, actually losing weight and maintaining that over a long period of time, there aren't a ton of people that have showed that success over many years. So our population to work with is limited, as well as there has been a lot of talk about anti-obesity medications in the last several years since they have hit the market and what that looks like and their benefits for different chronic diseases. We don't have information right now and enough studies and enough time for us to really look at the data to look at if those anti-obesity medications really have a reduction on cancer risk. And then that chart on the right, I just wanted to break it down by state a little bit. Again, that is just a chart version of what I mentioned earlier about how our different states have varying levels of our populations that may be considered overweight or obese. And then again, the great news is that implementing the guidelines, this is from another study, that you can be 10% less likely to be diagnosed with cancer and also 25% less likely to die from the cancer. So again, the good news is that we have opportunities for improvement and to really help everyone. And I wanted to take a moment to highlight cervical cancer. So January is Cervical Cancer Awareness Month. And one really thing exciting about this area, it is a very preventable disease. There's actually many states throughout the US that have cervical cancer elimination plans because we can get to almost 0 cases. That is possible. So in countries like Scotland, they implemented a really well-rounded vaccination program in 2008, and they actually have seen, they reported just about a year or so ago, that they have seen 0 cervical cancer cases among the people that have been vaccinated for it. So that is great news, and that's what we're working towards. So I'll talk about that vaccine just a little bit more. But also we have screening recommendations. So these come down from the United States Preventative Services Task Force, and they create recommendations based on the data about who should get screened and at what ages and what frequency. So I want to make sure that everyone knows that for women beginning at ages 21, they should be getting screened through a pap test. and that can be done through your primary care provider or your OBGYN. And if you have normal results, so it's every 3 years. Then once you hit the age 30, that's 30 to 65, you can continue with the pap test every 3 years when you're having a normal result. There's also an HPV test that can be done every 5 years with a normal result, or you can do both, which is co-testing. And you can do that every 5 years if you have a normal result. And then if you're 65 or older, this is where shared decision making with your provider becomes really important. And so based on your screening history, your age, and your current health, you may decide to continue or discontinue screening. But again, these are important conversations to have with your provider. So I want to touch on what I said about the vaccine. So many people don't know that we do have a cancer prevention vaccine, and that is called the HPV vaccine. HPV stands for human papillomavirus. It's a large group of common viruses that are spread through intimate skin-to-skin contact. However, they're very, very common. It's just like the common cold. About 9 out of 10 people will get it in their lifetime. And so, like I said, it's a really big group of viruses, and some of them will go in and out of your system. Your immune system will work it out, no harm, no foul. You might not even know you have it. And then we have other strains that are a little bit more harmful that can cause different types of cancers like cervical cancer. So the HPV vaccine actually protects against 6 different types of cancers, and it is approved for both boys and girls starting at age 9. So our ideal range for folks to get vaccinated is 9 to 12 because we see them have the strongest immune response, but it is approved up to age 46. And again, that's where it comes to really important to talk with your provider if it's appropriate for you. I always like to mention this is a prevention vaccine. So it only works if you haven't been infected with the HPV virus yet. And that is because we build up strong immunity and then you can be exposed. So that's also why we encourage it at a young age, because once you've been exposed to HPV virus, this vaccine unfortunately isn't very beneficial for you. And if you receive it on time, that's going to be a 2-dose series. And these vaccines are available at your primary care provider, your pharmacist, your local health department, and so on. And then if you're looking at our chart on the right, that is a cervical cancer screening in 2021 broken down by race and ethnicity. So the bars on the right is from our United States Preventative Services Task Force. And then the bars on the left are the American Cancer Society. They have slightly different recommendations, a little bit more emphasis on the HPV co-testing. And so they just did a comparison. Long story short, we have a way to go. Not everyone who is eligible to get screened is getting screened. And so that's really our mission to help improve this. All right, so continuing with cervical cancer, I jumped ahead a little bit looking at the primary cause. The number one risk factor for cervical cancer is HPV infection. That actually causes 90% of our cervical cancers. However, I did want to talk about the influence of obesity with cervical cancer. So if you noticed earlier, I talked about the associated cancers that are linked to increased risk with obesity. Cervical cancer wasn't on that list. Actually, right now, it's a little bit inconclusive for the studies we have. However, those with obesity are at increased risk for cervical cancer, but it's not from a biological perspective at this point. What we are seeing is that those with higher BMI have lower cervical cancer screening rates. Cervical cancer is a very slow growing cancer, so that's why it's really important to get our screening done, because we can check early, or detect cancer early, and then have the best treatment options. So for folks that are obese, it can make pelvic exams uncomfortable. There might be a stigma associated, or there might be some additional barriers that prevent people being screened. So those with obesity are more likely to delay care. And again, some of it comes with that stigma. So while healthy weight does not prevent HPV, I do want to emphasize that those with obesity are shown to be at increased risk for cervical cancer. Then the graph on the right, again, breaks down our different states. This is from the immunization team survey across the United States, looking at which states have all the up-to-date vaccinations. So that would be those 2 doses. Specifically, this map is looking at those that are aged 13 to 17 years old, with the darker states having the lowest vaccination rate. So we really want to raise those. We're trying to be closer to the 80% range. Okay, so taking a look at the rural impact. Rural counties tend to have higher obesity rates. And again, this is really multifactorial. Here's just a few reasons that might be contributing. So there might be limited access to affordable, healthy foods. So in our society, we're very, very accustomed and it's normalized to eat ultra processed foods. Unfortunately, a lot of those can contribute to increased weight gain and then therefore increasing cancer risk. Sometimes in rural areas, we may not have some great areas for physical activity, whether that's well lit, whether that's sidewalks. That could be a long list of fits. Maybe there's not a park in the area. So just having limited opportunities for physical activity, which is really important. Folks also might be working longer hours, or there's the agriculture demands and seasons that can contribute. And then because of some of these barriers and others having high cancer risk and more late stage diagnoses is what we're seeing. So again, the geographic location, it being a long time to travel to get care, the transportation barriers being there might not be public transportation, reliable cars, and there might not be Ubers or other Lyft type opportunities. Provider shortages, there also might not be oncologists in the area, or there might be one OBGYN. So again, shortening our opportunity to seek care. Those economic constraints mentioned a little earlier, but some of those jobs or other professions where time off just might not be flexible. And often those times, Monday through Friday, 8 to 5, is when provider offices are open. There's also the challenges of those digital divides. So broadband internet might not be available everywhere. So some of the telehealth opportunities that I think we can incorporate and utilize better for cancer control and prevention might not be available. And then the general weight stigma that I mentioned earlier that might prevent folks from seeking care. All right, so I really talked about obesity as a whole and the increased risk, and I kind of want to put this conversation to the side. So outside of your weight status, physical activity can reduce your cancer risk. So we know that it can reduce risk for the 7 cancers that are listed. And that, again, this is probably going to grow, but it's what we know for now based on our great studies that we have. 6% of all those cancers combined can be attributed to the lack of exercise. So again, weight status aside, if you're not exercising, unfortunately, you're increasing your cancer risk. The World Health Organization recommends at least 150 minutes of moderate intensity activity, and then or vigorous 75 minutes of vigorous activity. So vigorous is really classified about how you're breathing, if you're able to hold a conversation, if you're able to sing. If you aren't able to do those things, you're most likely engaging in your more vigorous activity. And there are recommendations for our youth as well. So working towards that 45 to 60 minutes of the moderate activity daily as well. And sometimes in our society, it's really hard to get this in and make time, but not everyone can really jump from 0 activity to 150 minutes. But what we are seeing that any improvement in activity is important. If you're going from 0 activity to 20 minutes a couple times a week, that's absolutely great. That is helping to reduce your risk and then hopefully working up to these recommendations. There aren't many people that don't engage in any leisure time physical activity. So you can see this chart of the United States on the bottom, again, with those those lighter shades being the lower, the 16 to 20% that engage, and then upwards to the 25 to 51% category. So how does this work throughout the body? Again, I touched a little bit on how the obesity mechanisms worked out, but I wanted to check on the physical activity a little bit. So having reduced weight gain, there's an easier maintenance of a healthy level of body fat. You also have improved insulin sensitivity. So if you look back at those mechanisms we talked about with obesity and our insulin impact on tumor growth factors, And then you'll lower your insulin levels. Having lower levels of those sex steroid hormones. So I did touch on the estrogen a little bit and how that increased risk for some cancers. Then you're having more rapid gut transit times. So especially thinking about colon cancer and in our diet, and I'll get into that a little bit, we're having reduced time in our body with some of those carcinogenic exposures. And then we have improved immune function. I talked a little bit about our immune system with our HPV infections. And so that is kind of the circle, just a sum of possible mechanisms how physical activity can be very beneficial. All right, so looking at our dietary factors, again, I want to set this aside, just looking at dietary factors in a sole um, vacuum. So 4% of cancer cases and deaths are attributed to an unhealthy diet. And so I wanted to talk about what does that really mean? So a lot of the time we're saying eat whole foods, eat less processed foods, but specifically there are some foods that are actually considered carcinogenic, meaning that they do cause cancer definitively. And so a couple of these things are looking at red meat and processed meat. So processed meat is linked to cancer risk. And that's going to be some of the things I know we do love, like bacon and sausages and hot dogs. A lot of those pre-cooked meats that you're seeing on the shelf. I will say I do get asked about rotisserie chickens, and those are not considered processed meats. So those are not considered carcinogenic. However, our hot dogs, our deli meat, which is unfortunate, is really not great. When it comes to red meats, we advise that under 18 ounces a week is a safe level. Above that, you may start to increase your cancer risk for colorectal cancer. And so just, based on the studies we have and to be safe, that seems like a safe threshold. What I will say is these are things that increase our risk, but food can also be very beneficial. They can be protective factors, meaning they protect us against cancer. So our fibers that are high, our foods that are high in fiber are one of those protective factors. So you can find a lot of fiber in berries like raspberries, some of our really green vegetables, and some nuts as well can be great sources of fiber. And that can really help reduce our risk for colon cancer, among some others. Sugary drinks is also something I get asked about a lot. So those are not considered carcinogenic or that they necessarily cause cancer. Right now, we have inconsistent evidence. But what we will say is that sugary drinks definitely contribute to our increased body weight. And so being at an unhealthy weight or obese, which then does increase your risk. At the same time, it is proven that sugary drinks do cause other chronic diseases, including increased cardiovascular disease, hypertension, cavities, and so on. So at the end of the day, agencies do like to focus on this because it hopefully is something that might be easier to cut out of our diets since we have other drinks that might be more beneficial. So looking at, again, the diet still, our healthy eating patterns are associated with a 7 to 18% reduction in cancer-related mortality, and especially looking at those risks for colorectal and breast cancer. They also correlate with reduced all cancer mortality and better health outcomes for cancer survivors. So I'll touch on that more in a little bit. But it's not only important for us to eat a whole foods rich diet to prevent cancer for those that do encounter cancer and during treatments. This can also help you increase the efficacy of your treatment and reduce your side effects, as well as reduce reoccurrence. So there are benefits no matter what stage of your life that you're in. I touched on some of the foods not to eat like our red meats, to eat less of like our red meats, and then definitely to reduce as much as possible our processed meats like bacon, deli meat, and hot dogs. And then highly processed foods in general, especially those refined grains, just aren't going to be great for us. But those other foods that are high in the vitamins, minerals, and other nutrients are really great to help us keep at a healthy body weight. Again, those dark green leafy vegetables are going to be great. I have a lot of fiber. I think people used to say a lot, eat the rainbow. That's still great advice to get a lot of different vitamins and nutrients in. Focusing on those fiber-rich beans and other vegetables like peas. Again, whole fruits and whole grains, wheat bread, brown rice are going to be great. So let's take a look at alcohol as well. I think this is very interesting and something people don't know as much about is that alcohol is actually considered a carcinogen as well, meaning that it causes cancer. So if you're looking at our cancer cases in silo, about 5% of cancer cases in men and 6% in women can be attributed to alcohol intake alone. So again, I'm bringing this chart up again that I shared earlier, looking at all our risk factors. Just under body weight, which we just discussed, alcohol is the next highest contributor. And so there are at least 7 cancers that are increased by alcohol use as well. The American Cancer Society came out with a strong statement a few years ago that no level of alcohol is safe. There have been a number of other institutions that have come out and agreed as well. What we advise is that you try to drink as little as possible. It is a risk factor that does increase as your level increases. So not only does it increase your risk for cancer, but saying if you're having 1 drink versus 9, that makes a difference in your increased risk. The general advisement is to limit to yourself in more than 1 drink a day for women and 2 drinks a day for men. So then taking a look at cancer survivors, as of 2022, we know that there are at least 18 million survivors in the United States. So that is a whole lot of people, a whole lot of people that have experienced something very traumatic. And so we would love to reduce that number if we could, for those folks that hopefully will never get cancer. As I mentioned, diet and physical activity are really important for our survivors. I simply have highlighted breast cancer here, but looking at our diet, it can improve overall survival when we're sticking to those whole nutritious diets. And then looking at physical activity, being stronger is linked to a lower risk of death from breast cancer and other causes. And then decreasing physical activity after diagnosis is linked with higher risk of death from any cause. So, and then we have some studies that do look at body weight, cancer reoccurrence, and death as well. And at the end of the day, physical activity has been proven to be very positive for survivors. The American Cancer Society actually has survivorship guidelines that go into this in a lot more detail, and it touches on more than just diet, physical activity. And it really is a guide, a toolkit to say how we can help support survivors, what they really need, and resources they might need. So I really encourage anyone who might be interested to check that out. This is just a really great summary of a lot of the components that contribute to our healthy weight. I've talked about general cancer prevention and some things we can control and some things we cannot on the prevention side. And so these are some of the aspects that we can control. I've already touched on being a healthy weight and be physically active, looking at our diet, limiting consumption of this fast food or those other processed foods, the red meat, our sugar sweetened beverages, our consumption of alcohol. I also do get asked a lot about our supplements for cancer prevention. We don't not have any great studies that prove that is beneficial to reduce our cancer risk. So we can't say that at this time. Also for mothers, if you can breastfeed your baby, that is great. Not only for the baby, but also for you, it can lower your breast cancer risk as well. And then looking at our aftercare for diagnosis, again, touching on those survivors and how these can play a crucial role to improve our survivorship and quality of life. All right, so it is really easy to say, hey, do these things, eat healthy without acknowledging that that might be hard for folks to do. So I did want to share a little bit of data. The definition of food insecurity is a lack of consistent access to enough food for an active, healthy life due to the lack of financial resources for food at the household level. So in 2021, that 10%, a little over 10% of households were classified this way. That is the lowest on record. I think that has shifted somewhat. But again, over 33 million people have experienced food insecurity. So if people don't have the means to access healthy whole food, reduce their cancer risk, we can't ask that of them. So we really need to work on the holistic community policy side to make that possible for folks. And again, there is a great toolkit focusing on increasing our food efforts, and that's listed there. Okay, so a lot of not so great news, a lot of good news about how we can prove how these healthy behavior activities can benefit our health overall, our chronic diseases, our cancer risk. But where does telehealth play in all of this? So there are really some great opportunities. I think when COVID happened and the emergence of people not being able to seek care in our traditional settings, telehealth was explored a lot more, even though it had been around. And there also had been an increased insurance coverage for telehealth visits. So within caring for a person as a whole, but especially in the cancer prevention and early detection spheres, telehealth can be really beneficial. So it can provide education about HPV and cervical cancer, and also check in with folks about their screening, the recommended screening times and eligibility. Also using different types of screening assessments. And again, this goes beyond cancer, our mental health assessments and so on, but can be very beneficial to use like cancer risk assessments, which we talked a little bit about the components we focused on today, but those might also focus on family history, tobacco use, and other components of your life, which would help determine if you're at higher risk or lower risk and when you should get screened. And those really help prompt great conversations with your provider to determine that for you. It can also help coordinate appointments and set reminders. The FDA has recently approved at-home testing for cervical cancer screening. That is going to be coming down the pipe soon. So I think there's going to be a lot of opportunities like there is in the colorectal cancer space, where we do have home-based stool tests for colorectal cancer. So if you can have a telehealth appointment, have that conversation with your doctor if you are eligible and right to be screened, and if that's a good test for you, it can then be mailed to your house. You can complete the test and mail it back in. So that could reduce some of the transportation barriers that we had mentioned earlier. And also the time off work. I mentioned that earlier. That is continually a challenge for many folks. Also, the telehealth could help with that continuity of care, the familiarity with that contact, and help reduce some of those anxiety and stigmas that might be associated with the word cancer in general, or seeking care, or just going to the doctor in general. And then I touched on the HPV self-sampling programs, which would be our screening tests. And then it can really help improving navigation. Telehealth visits can follow up with certain results, talk about next steps, and also help coordinate to further care if you do need to see a specialist or seek further providers. And then hopefully we can do a better job of tracking some of our follow-up testing. Like I said, for those abnormal home-based tests, then you will receive more screening that would happen in person. So it can help with that navigation. Telehealth can also help with our weight management support. So there are increased organizations and resources for virtual nutrition counseling, physical activity coaching, and other evidence-based weight management programs. Again, it can help with the regular check-ins while they're participating in any of these programs, and also address some of the other healthy behaviors that will be associated with weight management. And some of those might be the remote monitoring tools, things that track our steps, our food logs, and so on. But outside of focusing on healthy weight for cancer prevention, a healthy weight also supports the reduction in risk for other chronic diseases such as diabetes and hypertension. These are other obesity-related conditions. So we can also help reduce the amount of folks that have these as well. And it can also provide an opportunity for support to set realistic goals, which is going to be really important for sustainability for weight management and seeking a healthy weight. So I touched on it a little bit more, but specifically in cancer treatment and survivorship, when our folks, our community, and our patients have to go through treatment, especially sometimes during chemotherapy, they may experience side effects. And so telehealth can really help keep them in their home, keep them where they're comfortable, but still managing those side effects and making sure their quality of life is still really great. And some of that follow-up testing, like reviewing images or lab support. Also, among our survivors, psychosocial support is very, very important, that they feel mentally supported, that they have the resources, they find peers to talk to. There are a lot of organizations in Indiana, where I am, and throughout the country that actually have online support groups now. So you can enter Zoom meetings or similar. And so this area has continually grown, and people have really asked and shown support for it. And then again, it can reduce that travel burden, especially for our rural folks. All right, so that was a lot of suggestions, but I did kind of wanted to wrap up addressing our providers, our other healthcare, our community programs. If we can incorporate telehealth into our routine preventative care, that's going to be huge to really touch on some of the things that we may not have time for in our yearly annual physical exams. It is also an opportunity to talk about a healthy weight, think about trauma-informed communication. We really want to reduce the stigma. We really don't want anything to prevent people from seeking care. We can also provide HPV or education about HPV vaccination and where to seek that. Again, I mentioned starting at age 9, it's available. And so those vaccine discussions can happen virtually as well. Also, it's an opportunity to bring in interpreters as well. There's a lot of great programs. Some people might not seek care because they might not speak the language in the area or English, but we can have someone also join the call that can then interpret. And so that can really be helpful for reaching some priority populations. Also, to partner with community organizations to host events and do so to reach more people. On the other hand, it is very important that we provide education on how to use these telehealth platforms. It's really, really great if they're out there, but if people don't know how to use them, so we're not using them, then that really doesn't provide benefit to anyone. And I mentioned again, our risk assessments for cancer, and also our referrals for genetic counseling. So if you have a family history, you may be referred to a genetic counselor who can then do a deeper dive and discussion with you about your family history and if you should seek screening at any earlier than the average population. All right, so just some takeaways. I know that was a lot of information, a lot of data to get through, a little bit of a data nerd, but maintaining a healthy weight supports lowering your cancer risk and also improves your access to screening and treatment, often because that's stigma related. Cervical cancer is highly preventable with vaccination, regular screening, and early detection. Telehealth can expand access and reduce some of those barriers and increase the continuity of care across the cancer continuum. And also integrating these virtual services with in-person care can increase access and create a patient-centered system. And then I just plugged in a few resources. There's a million out there. Cancer support community, I have Indiana in there, but they're a national organization. There are a lot of survivor organizations. There are a lot of great places where you can find board certified oncologists and nutritionists. The Live Strong program is also throughout the United States. So I can share plenty more resources, but these are just a few that would be beneficial based on the subjects we talked about today. And that's all I have, but thank you for having me.